Dr. Mathew Devine, the medical director at Highland Family Medicine, is with us. Doctor, good morning. Thanks for a few minutes.
Good morning, Mark.
We are into March, and you know as well as many that this is Colorectal Cancer Awareness Month. Why is screening for this form of cancer so critical?
I think it's very simple, Mark, that colorectal cancer screening saves lives. This is a very common, it's the second leading cause of cancer in the United States aside from lung cancer, and over 50,000 people died in 2021 of colorectal cancer last year alone.
Yeah, the numbers are staggering when you put them that way. Who is at risk, doctor, for colorectal cancer?
Great question. So for colorectal cancer, men are more at risk than women. African Americans are more at risk than other races. And, I think the biggest thing is it's about an age thing. So about 80% of these cases are diagnosed in those that are 55 years or older.
Well, let's stick with the age theme here because that's the question that's on a lot of people's minds. Who should get screened and again, more importantly, when? When do we get screened for colorectal cancer? When does that begin?
Right. So I think that's a great question because really within the last year, it used to always be age 50, but now it's age 45 that should start. And so that is a new change that people need to be aware of. And so at age 45, you really want to discuss this with your clinician. And after age 75, you can stop necessarily with treatments, but that's another discussion you want to have with your team.
And a last one here, what options are available when it comes to screening? We fall into that age range. What's the next step?
Yep. So there are a bunch of different options. I think the gold standard is called a colonoscopy, where you go and get the procedure done at a medical center. But there are a bunch of home tests, like a stool test that you can do at home, similar to something like this that comes in a packet that you get at your doctor's office. And then you take it home and you kind of do it yourself and send it in by mail. And that is a test that can be done on a yearly basis at least. But I think the biggest thing is because of the pandemic, there have been some delays in getting things like elective procedures and tests done. So if you're behind, thinking about those home tests first makes sense because there is a backlog in getting in for things like the colonoscopy. So really important that I'm happy that it's the month of March here and that we're thinking about this because, again, this is something that we have fallen a little bit by the wayside throughout the course of COVID.
And because there is screening available, doctor, it is critically important that our viewers are proactive when it comes to this. Thank you for your time.
Thank you.
If you missed any of our conversation, we'll share it online as we always do. You'll find it posted at rochesterfirst.com.